All right. Good morning, everybody. Thank you for joining me. My name is Mark Stasic. I'm with Rummel Benefits Group and wanted to give you an update today on the 2025 Medicare changes that we know so far, and most of those as a result of the Inflation Reduction Act. So what to expect, this will be about 15 minutes with some Q&A. I'm going to give you a brief overview of Medicare and what your options are during AEP, and preliminary information that we have on the Inflation Reduction Act's changes to Medicare. Just so you know, we don't have product information yet available. Usually that comes out around October 1st, but we are getting some ideas from carriers what to expect, and I wanted to share that with you. Why we're doing this now is because we do expect significant changes in 2025, and we want to just keep you informed and help you make the good decision as you head into next year. As you've seen in the registration link for this webinar, you can set an appointment for a phone, Zoom, or in-person review for 2025. I'll share those links again at the end of the presentation. So a quick overview of Medicare, as you probably remember, you have original Medicare Parts A and B, which are provided through the federal government. And then in addition to A and B, you can either choose, generally speaking, you can either choose Medicare Advantage with a Part C, often paired with the hospital indemnity plan, or you can do a Medicare supplement, often called a Medigap plan, with a separate prescription drug plan. I'm going to share more in about a month. I'll do another presentation on the Medicare Advantage with hospital indemnity and that whole concept, and just kind of give you an overview. So more on that to come. With annual enrollment period, or AEP, this happens every year. It's October 15th through December 7th. The changes that you make in that window take effect on January 1st. So prior to an appointment with us, we need to send you what's called a scope of appointment confirmation form. We do that via DocuSign. And if you do meet with us via phone or Zoom, just be aware that meeting per CMS, the Center for Medicare and Medicaid Services, that meeting has to be recorded. We do have some limited meetings available with me in person in October, and I'll share that information with you again via email so you can start planning ahead for 2025. So looking at the Inflation Reduction Act, this was passed in August 2022 by the Biden administration. There was a whole bunch of information or a whole bunch of legislation, within that bill. But regarding Medicare, the goal of the Inflation Reduction Act was to reduce prescription drug costs for Medicare enrollees. So what we've already seen, if you've been in Medicare for the last few years, you may remember in 2023, there was an expansion of the Part D vaccines. So probably the most notable one, at least in terms of my experience with clients, was that Shingrix vaccination became available at zero cost for shingles. There were a number of others, but Part D vaccination became expanded in 2023. You also had the insulin savings program, which put the $35 cap on covered insulins. And then in 2024, the current year, we saw the catastrophic phase go down to zero. So prior to that, you were responsible for 5% of medications in that catastrophic phase. Now the client's responsibility is zero. We also saw expansion of access to extra help for medications for low-income enrollees. But what we expect in 2025 is a whole lot more. So you're going to have an annual out-of-pocket maximum of $2,000 for prescription medications. We're also going to see the elimination of the coverage gap or donut hole, and then kind of by default, a sunsetting of the coverage gap discount program. There is going to be the establishment of a new discount program that requires manufacturers to provide discounts on applicable drugs in the initial coverage and catastrophic phases. And then changes in the cost sharing among enrollees, plans, manufacturers, and Medicare. So changes in the percentage of who's responsible for what portion of the costs throughout the different phases of Medicare. So probably as we're looking at it, the first bullet point and the last bullet point are the two that are really going to cause some changes for us in how we look at prescription drug coverage and costs. So here's the first one, Medicare Prescription Drug Payment Plan Program. So beginning in 2025, all Medicare prescription drug plans, whether you are on Medicare Advantage or you're on Medigap or Medicare Supplement with a separate prescription drug plan, all prescription drug plans are required to offer enrollees the option to pay out-of-pocket drug costs through capped monthly payments instead of paying all at once or pay as you go when you go to the pharmacy. So I'll give you an example of a moment, or an example of that in a moment. You can opt in for this program at any time, but your option is just for 1 year at a time. So you have to opt in each year as you go, and then set up monthly payments to the insurance carrier. The way that they'll factor that payment is to take your remaining balance of the $2,000 out-of-pocket maximum and divide it by the number of months left in the calendar year, and that will be your monthly amount that you have to pay to the insurance carrier. So if you are on no medications or some low-cost medications, this program probably won't make sense for you to sign up for. You can just pay as you go out of pocket at the pharmacy like you have been. For those who are on high-cost medications, then this might be of interest to you. So we'll look at an example here. Jim, our example, not a real person, but Jim knows he's going to hit the $2,000 out-of-pocket maximum due to expensive medications that he is taking. So Jim goes to the pharmacy in January. The pharmacist says, "Hey, Jim, that medication is going to be $850. Just making up numbers here for that part. But go to the pharmacy. The pharmacist says, "Hey, you owe me $850 for this script." Jim can say no at the pharmacy and still get his medication that day. So what will happen in that case is the pharmacy will notify his insurance company, whether you're with Blue Cross or HAP or Priority Health or Aetna, SilverScript, whoever your drug coverage is through. So the pharmacy will notify that drug carrier, and the insurance company is going to take whatever's left of the out-of-pocket maximum. So in this case, I put January to make it easy on myself, but assuming that he hasn't paid anything yet towards that $2,000 maximum, they're going to take $2,000, which is what's left of his out-of-pocket max, divide it by 12, and then send him a bill every month for $167 until the end of 2025. So again, if you're on some expensive medications, this might sound attractive. What happens currently is you've got these different phases of coverage. You've got your deductible, then you've got your initial coverage phase. So maybe you're at like a $47 copay for your medication, and then all of a sudden you hit the coverage gap or donut hole, and now you're paying 25% of the cost of the medication. And then towards the end of the year, maybe you got into the catastrophic and you were paying zero. That roller coaster of costs that you may have experienced in the past throughout the year will go away if you sign up for this program, and you'll just have a flat monthly payment. So it'll help kind of just make more consistency in what you're paying each month. It'll help you hopefully from a cash flow perspective. That's kind of the idea. If you're not taking expensive medications, again, really no point in signing up for this program. What I'm curious to see, though, this is new for the insurance companies, this is new for everybody. The insurance companies are not currently structured, to do this because they haven't had to in the past. So there'll probably be some hiccups as this gets implemented. New for them and invoicing and collecting on something, and new for you and receiving a bill. It's another invoice separate to what you're paying in premium. A lot of logistics here that the insurance companies are kind of scrambling right now to figure out, but that's what the legislation says. So for 2025, just kind of a preview of how drug coverage will look. The deductible amount is going up. Now, not every plan has a deductible, but currently your plan can have a deductible up to a maximum of $590. Currently it's $545. In 2025, it will be $590. Then you go into the initial coverage phase, which is where you have either a flat dollar copay or a coinsurance percentage that you're responsible for the medication. And that depends on what tier medication you're taking. There will be no more coverage gap or donut hole and no more catastrophic. So those are going away and are being kind of replaced with this $2,000 out-of-pocket maximum. So that's the structure of coverage for 2025. As we look at 2024 versus 2025, here's how it is right now. So 2024, we've got your deductible phase in light blue, deductible at $545. Then this initial coverage phase. So this is an estimate of what, if you went all the way through that initial coverage phase, you would pay about $1,200, $1,300. It is an estimate because it depends if you're on brand name or generic medications, the way that formula is calculated, but kind of on average, if you went all the way through that initial coverage phase, you would have paid about $1,200 to $1,300. Then you'd go into that coverage gap or donut hole where now you're responsible for 25% of the cost of medication. Again, just kind of an estimate, you would have been responsible if you went all the way through the coverage gap and got to the catastrophic, you would have paid about $1,500 or $1,600 out of pocket for a total for the current year of about $3,300, $3,400, somewhere in that range is what you would have paid if you maxed out all those phases. For 2025, your deductible does go up. It's $590. And again, not every plan makes you pay that deductible phase, but that's what they can charge you is up to $590 for the deductible. And then you'd have about $1,400 left, $1,410 left to hit your $2,000 cap. And so what we're looking at and what insurance carriers are looking at is what happens to these costs, right? Because they don't just go away. And I can assure you that they're not just going to get absorbed by the insurance companies. So don't be scared off by this chart. I'm only going to be on here for a minute, but right now you are the orange, you're the enrollee. So this shows, it says current law. This was 2023 when it was created. Obviously currently it's 2024, but this is what it's looked like when the Inflation Reduction Act got passed originally in 2022, and the phases started to take effect in 2023. So you are orange. So here's your deductible. You're always responsible for up to 100% of the deductible. So that does not change. But in 2024, in that initial coverage phase, you were responsible for about 25% of the cost of the medications, and the drug plans were responsible for the other 75. Your portion of that won't change. You're still at 25, but the new rules do include the drug manufacturers in a portion of that responsibility between the manufacturer and the drug plans. 2023, once you got through the initial coverage phase, you went into the catastrophic and you were paying, I'm sorry, I misspoke. You went through the initial, you got into the coverage gap, you're still responsible for 25% of the cost of the medication. And the manufacturers had this discount program to help with the costs of this 70%. The drug plans paid 5%. So you were in the coverage gap here. You're still paying 25% of the cost of medication in the current year. If you hit the catastrophic phase, you would go to 0. Medicare was paying 80. The drug plan was paying 20. In 2025, you've got this new cap. So $2,000 spending cap. There's no more orange. There's no more responsibility for you after this cap. So what happens is the drug plans are responsible for 60%, manufacturers 20%, Medicare 20%. Curiously, Medicare changed their own percentage from 80% to 20%, which is nice for them to be able to do that. But the rest of us, don't have that kind of power. So what is going to happen, we think, unfortunately, is the drug plans and the drug manufacturers are not just going to eat these costs, right? So they're going to find a way to pass those costs back on to us as the consumers. What that means is what we're hearing from carriers. Again, we don't have plan information for 2025 yet. We'll get that to you probably in October when it becomes available. What we expect is fewer plan choices as the insurance companies adjust to these new rules. So they may eliminate some plans. They may, if they did plan on adding some plans, they probably won't next year, whatever that looks like for each carrier. But we do expect to see fewer plan choices and as insurance companies adjust to these new rules. We'll probably see more strict drug formularies, which may limit your ability to access certain medications because these drug formularies, if the insurance companies are responsible for a higher portion of the cost, then they might start limiting what they're offering in terms of those expensive medications. We do expect you'll probably have more drug utilization reviews, which means prior authorization, step therapy, or quantity limits. Reduced benefits on Medicare Advantage plans. And so Medicare Advantage plans kind of have the upper hand in this situation compared to Medigap and drug plans, because with Medicare Advantage, all of your coverage is tied into that one plan. So you've got your hospital, your medical, your prescriptions, your dental, vision, hearing, your over-the-counter allowance, the gym membership, all those things are tied in on Medicare Advantage. And so what we expect, if they know they're going to lose money in one area, like prescription drug costs, they're going to try to make up some of those losses in other areas, right? So right now, if you have a $45 copay for your specialist visit, they're going to probably, yeah, I'm just making this up again, but to give you an example, if to make up those costs, if you have a $45 copay on your specialist visit, next year it might be 60, right? Or if you have a $1,500 dental allowance currently, maybe next year it's only 1,000, right? So they're going to make adjustments to those Advantage plans, and make up what they expect to lose in prescription drug costs in other areas of that coverage. With prescription drug plans, so if you are on a Medigap plan or Medicare supplement plan right now and you have a standalone prescription drug plan, they don't have any other levers to pull, right? They can't change your copay for medical or hospital or dental services because all they do is drug coverage. So we do expect significantly higher premiums on standalone prescription drug plans. That affects you if you currently have Medigap or Medicare supplement with a PDP. That means you're probably going to see a premium increase on your prescription drug plan, whether you're taking expensive medications or not. Speaking of Medigap, so the Medigap coverage, the loss ratio for Medigap plans, which is a factor of premiums versus claims, basically, but that loss ratio is coming in at all-time highs. We're seeing a lot of people pursuing medical services, and that loss ratio has gone up. And so healthcare costs have continued to rise. Believe it or not, if you've been enrolled in Medigap, you might you might feel differently, but Medigap rates for the last few years haven't gone up all that much. So you have your age-based increase on most plans, but the increase in rate has only been about 2.6% per year for the previous 5-6 years. Again, you might say, well, what do you mean? I got a $15 increase per month last year. Part of it's age, part of it is rate increases, but overall, the Medigap rates have not gone up as much as some other forms of health insurance have in recent years. So we do expect pretty substantial increases, 10 to 15% rate increases in addition to your age-based increase over the next few years. Again, that's not just me speculating. This is what we're hearing from carriers as we get information for 2025. Medigap, Medicare supplement Medigap plans, the fate of those plans is somewhat tied to prescription drug plans. So the Medigap plans give you provider flexibility. You don't have prior authorizations, all those great things that we've talked about in the past for Medigap. But unfortunately, if your prescription drug plans make such a big increase, we might see a lot of people decide, you know what, I'm going to just switch over to Medicare Advantage. It's kind of what we expect to see. So what do we do now? We'll get you plan information as soon as it becomes available. Usually for us, that's around October 1st. If you've signed up for a review appointment, I'll be sending you the scope of appointment confirmation that'll come from DocuSign. And then we'll update your prescription drug list and be ready for your appointment as we get into October. Again, I think you may want to consider, and not that everyone should do it. I wouldn't make a blanket recommendation, but I think we're going to have a lot of people this year consider switching from the Medicare supplement or Medigap and drug plan to Medicare Advantage and with or without a hospital indemnity plan. As those differences in cost continue to increase, I do think we're going to see a lot of people say, you know what, I'm gonna cut my losses here and switch over to Medicare Advantage. My approach, if you remember from meeting with me, I always lay out both options, try to give you enough information, give you the facts to make an appropriate decision for yourself. And we look at costs, and as that difference in cost from Medicare Advantage to Medicare supplement with a drug plan continue to go up. Again, I do expect a number of people this year to probably switch from their supplement to Medicare Advantage, but we'll talk through your options specifically and what you need and help you make a decision from there. So if you want to schedule a review appointment, check the email from what we sent out for you to register, because it's probably easier than trying to capture this here. If you can capture it, great, but you can set an appointment via my Calendly links. You can call us or you can email me at mstazek@romoinsurance.com. So thank you very much for joining me. We'll get you more information as it becomes available, and have a great rest of your day.